Okay, I think we're good to go. All righty. Good afternoon, everybody. Thank you for joining my webinar today. My name is Jessica Hazen, and I am with Portland Pediatric and Family Nutrition. Today's webinar is entitled Eating for Two Essential Nutrients During Pregnancy. I just wanted to welcome everybody that's joining today. If you're able to join, or if you're viewing this at a later time, welcome. Whether you're expecting or whether or not you are interested in becoming pregnant or just interested in the topic, I welcome you today. You're welcome to ask questions during the meeting. I'm going to hide the chat box and wait till the very end to answer questions. That way I can get through the presentation. But welcome. Pregnancy is just such an exciting time in a woman's life. It can also be kind of scary, as there's a lot of unknowns with pregnancy. There are a few things that we can control, and one of those being what we're eating during pregnancy. Nutrition plays a huge role in the development of baby and in mom's health throughout pregnancy and delivery. So that is why we're talking about this topic today. And this picture that I have on here is actually my sister. So I wanted to share that. Let's see. No, it's not going to the next slide. Here we go. Okay, I wanted to give a little bit about information about myself. I am a registered dietitian, nutritionist, and have been for about 5 years now. I mainly worked in the WIC program, with the WIC program in Arizona. I am super passionate about helping women prepare and navigate their health and nutrition throughout pregnancy and during lactation as well. I'm a board certified lactation consultant, so I love to help women with their breastfeeding concerns or education as well. I'm new to private practice with Portland Pediatric and Family Nutrition, but I am able to see clients in both our Portland and Vancouver offices. I am a wife and a fur mom to my pup Charlie, and that's a picture of her there with my husband. And I'm also an aunt to a 5-month-old nephew, Kieran, who I'm super obsessed with, and it's been kind of fun. I enjoy the outdoors, traveling, and really doing anything active. So we'll just hop right in. The objectives for today's presentation will be to discuss why nutrition is so key during pregnancy, what nutrients play a big role during pregnancy, and what those roles are. We'll talk about food sources of those nutrients, and then other considerations as well. So why is nutrition during pregnancy so important? Obviously, there are extra nutrient needs to meet the demands that are needed to meet the demands of our body, as well as our growing baby during pregnancy. Specifically to help develop those maternal organs, such as the uterus, the placenta, and breast tissues that are important during pregnancy. Also to help build up reserves to be utilized during the time of delivery, as well as lactation is super important. And the health of the newborn really depends on the nutritional status of the mother, both during and prior to conception. So I think a lot of women that aren't currently pregnant and are thinking about that in the future, it's good to be aware that your health prior to becoming pregnant is also super important for the health of your baby, your future babies. A well-nourished woman typically has less complications during pregnancy and has fewer chances of premature delivery. A maternal diet also has a direct influence on the size of your baby, the health of your baby, and poor diet during pregnancy can affect a mother's health. Really, if you think about it, during pregnancy, ultimately, as a mom, you're providing all of the nutrients that your child needs during pregnancy. So a malnourished mother still can provide those nutrients to her baby, but it's really at the expense of her own tissues and her own stores, and that's something we want to stray away from. We want to make sure that mom is healthy and baby is healthy. I think for most women, the goal of pregnancy, during pregnancy, is to make sure that mom stays healthy, baby stays healthy, and that we have a good outcome in delivery. So what key nutrients are important during pregnancy? And we'll talk about those today. Nutrients are obviously the building blocks of the body, and when you're pregnant, not only do you need those to maintain, like I mentioned, your body nutrients, but also to support the growth of your baby. So getting enough of these nutrients really during pregnancy kind of safeguards your own health as a mama and contributes to baby's normal development. So the key nutrients, we have our macronutrients, which are protein, carbohydrates, and fat. We also have our micronutrients, which are typically vitamins and minerals. And these are kind of the key nutrients, and we'll talk a little bit more about some other ones, but specifically folate, which is the recommendation is about 400 micrograms per day, iron, which is 27 milligrams, calcium, which is 1,000 milligrams, zinc, 11 milligrams, and DHA, which is a type of omega-3 fatty acid, which again, we'll get into more detail. But that recommendation is greater than or at least 200 milligrams per day. Protein. So protein is required for growth and repair of the muscles and our tissues. That's supposed to say tissues, not issues. During pregnancy, the addition of protein is required for the growth of the fetus, development of the placenta, increased maternal blood volume, so protein helps with that, and also formation of amniotic fluid. Protein is found in foods such as beef, pork, fish, poultry, eggs, dairy foods, beans and peas, legumes, nuts and seeds, and soy products like tempeh and tofu. Obviously, everybody's needs vary depending on each person, depending on your activity level, those sort of things. But typically, throughout pregnancy, an extra 15 grams of protein is required, but that is just a general number. For fats, fats provide energy and help build many of the fetal organs as well as the placenta. And it's also required for fetal visual development, so eye development of the fetus. Food sources, general food sources of fat are things like avocados, nuts and seeds, eggs, dairy, fish, meat products like beef and poultry. And as I was mentioning before, DHA is a type of omega-3 fatty acid. And this specifically is essential during pregnancy for brain development for baby and also preventing preterm births. And the recommendation again is at least 200 milligrams per day. Food sources of specifically DHA come from eggs, algae, and there's a lot of DHA fortified foods like orange juice and milk. Carbohydrates, another important macronutrient, is broken down into glucose, which is our body's main fuel source. And there are two types of carbohydrates. We have simple carbs and complex carbs. Simple carbs typically provide a quick energy boost. They're digested really quickly and absorbed really quickly, and typically they're higher in calories. So it's best to limit your intake of these. They come in things like naturally sweet foods like some fruits, table sugar, honey, maple syrup, and sugary drinks and foods with added sugar. So those are simple carbs. Complex carbs, include dietary fiber and starches. So this takes your body a little bit longer to process them. So they provide a longer lasting energy versus simple carbs. So usually we want to include more complex carbs in our diet as best we can. And those are things like bread, rice, pasta, starchy vegetables like potatoes and corn. Folate or folic acid. Folate is the natural form found from food sources, and folic acid is the synthetic form that's provided typically in supplements or added to some foods. And folate or folic acid can help prevent fetal neural tube defects of the brain and spinal cord and helps improve the weight of the fetus. So the recommendation is about 400 micrograms per day, and we usually recommend methylated folate. This is before and during pregnancy as well. So if you're of childbearing age and pregnancy is something that you're thinking about in the future, it's good to take this supplement or try to get these foods in folate as well. And the reason why methylated folate is recommended is because about 30 to 50% of the population have a mutation called MTHFR. It's a really long name, but it's MTHFR is the abbreviation. And a lot of people aren't aware that they have this mutation. And with this mutation, they're unable to break down folate to be used in the body. efficiently, or folic acid, excuse me, in the body efficiently. So methylated folate is just taking that type of supplement or eating those sorts of foods can help be better absorbed by the body. If you are interested or not sure if MTHFR is something that a mutation that you have, we do offer that test here in the office. So if that's something you're interested, just let us know. You can send us an email and we can get you set up to with the kit to take that test. Some of the foods that are fortified or enriched with folic acid, and those things are like grain products, bread, breakfast cereals, cornmeal, flour, pasta, and white rice. Natural food sources of folate come from leafy greens like spinach, broccoli, asparagus, Brussels sprout, beets, carrots, lentils and beans, citrus fruits like oranges and grapefruit, strawberries, raspberries, and nuts and seeds as well. Iron is another micronutrient that's super important during pregnancy, and it's essential for fetal growth, expansion of maternal tissues, including the red blood cell mass, building iron stores within the fetal liver, and to compensate for blood loss during delivery. The recommendation is about 27 milligrams per day, and food sources come in lean meats, poultry, seafood, leafy green vegetables like spinach, legumes, pumpkin seeds, quinoa, broccoli, tofu, beans, nuts, raisins, and dried fruits as well. And then there are also iron-fortified foods like bread, cereal, and pasta also. Calcium is our next nutrient. And during pregnancy, calcium is needed for growth and development of the bones and teeth of the fetus, maintaining bone strength as well, proper muscle contraction, and blood clotting. Recommendation is 1,000 milligrams per day, and calcium can come in food sources like dairy products, so milk, cheese, yogurt, broccoli, kale, spinach, soybeans, fish like sardines and salmon, those that have the little bones in them, calcium fortified foods like orange juice, oatmeal, and breakfast cereals. So when calcium intake is inadequate during pregnancy, the calcium is actually mobilized from maternal bones. So as I said before, if you're not getting enough of a nutrient, baby will take kind of from your stores. And that the demineralization of the bones can cause fractures and stuff in moms. So that's just something to think about. Zinc is another nutrient that's required for cell growth and for synthesis and functioning of DNA. So zinc's super important during pregnancy just because there is so much rapid cell growth during pregnancy, and zinc deficiency during pregnancy can cause poor outcomes during pregnancy, abnormal deliveries, including congenital malformations as well. The recommendation is about 11 milligrams per day, and food sources come from fortified cereals, red meats, oysters, shellfish, poultry, beans, nuts, peanuts, almonds, cashews, whole grains, and dairy products as well. So those are the top nutrients that I had just talked about, but there are some other nutrients that are also key and important during pregnancy listed here. Iodine is important. A lack of iodine during pregnancy can cause stillbirth, birth defects, and decreased fetal brain development. Vitamin A is needed in small amounts to protect baby's immune system and prevent blindness and infections as well. Vitamin D is required for formation of fetal bones. Vitamin K improves blood clotting to help prevent excessive bleeding and helps with bone development and for protein formation in the liver as well. Vitamin B12 helps in brain and nervous system development, vitamin C helps with increased iron absorption and fetal growth, and helps the body make collagen. And it's also an antioxidant to help protect the cells from damage. Vitamin B6 is required for a healthy development of the brain and nervous system. and can help prevent low birth weight and maintain blood glucose at normal and healthy ranges for fetus as well. So this just has a list of food sources from those nutrients that were just discussed. So we have iodine. The recommendation per day during pregnancy is 220 micrograms. Iodine is found in food sources such as milk, cod, shrimp, iodized salt, potato, turkey, beans, and eggs. Vitamin A is 770 micrograms per day. And vitamin A comes in those red, orange colored foods like sweet potatoes, pumpkin, butternut squash, carrots, spinach, cantaloupe, kale, collard greens, mangoes, milk, eggs, and broccoli. Vitamin D recommendation is 1,000 to 2,000 international units of D3. And this can come in fish liver oil, fatty fish, eggs, and milk. Vitamin C, 85 milligrams is the recommendation. Vitamin C is found in citrus fruits like oranges, grapefruit, kiwis, leafy green spinach, leafy greens like spinach, red or yellow bell peppers, strawberries, broccoli, and tomato. And then vitamin B6 recommendation is about 1.6 milligrams, and that can be found in foods like sunflower seeds, pistachios, fish, poultry, dried fruit, lean beef, bananas, avocado, and spinach. Vitamin B12 recommendations about 2.6 micrograms per day. That can be found, vitamin B12, in foods such as wild salmon, cod, soy milk, or soy products that are fortified, and shrimp, beef liver, yogurt, milk, cottage cheese, and fortified cereals. And then lastly, vitamin K recommendations about 90 micrograms per day. Can be found in foods such as cereals, meats, dairy, leafy greens like watercress, spinach, kale, broccoli, and Brussels sprouts. I want to talk about a few other considerations to think about during pregnancy. Caffeine is one that always comes up, whether or not that's something you can consume during pregnancy, how it will affect the baby, those sort of things. So the recommendation is less than 200 milligrams per day, which is about a 12-ounce cup of coffee. As we know, caffeine is a stimulant, and that can increase your blood pressure and your heart rate, which aren't really recommended during pregnancy. It can also cause changes in the sleep patterns or movement patterns of baby or yourself, and can keep you awake. And it's also a diuretic, and I know during pregnancy a lot of times baby's already kind of pushing on your bladder. Caffeine also does cross the placenta to the baby, and baby's metabolism is so immature it's not able to process it efficiently. So it's just something to think about. Alcohol consumption as well, that's something that can affect baby and is carried over to baby and can cause things like fetal alcohol syndrome. So typically that is not recommended during pregnancy. Herbal supplements, although herbs are natural and not all herbs are safe and some are contraindicated during pregnancy. A lot of times they're not approved or regulated by the FDA. So before taking any herbal supplements, I would definitely talk to your healthcare provider if that's something you're interested in. There are some herbs that may contain substances that could cause miscarriage, premature birth, uterine contractions, and injury to the fetus. So again, talk to your doctor if that's something that you're wanting to take. And then prenatal supplements. Obviously, a balanced nutritional intake is the best way to receive all the necessary nutrients, and they're the most bioavailable. But vitamin supplements can also be helpful. So remembering that supplements don't replace a healthy diet, but rather ensure that you are able to receive your daily nutrients if you're unable to eat them. You want to look for a food-based prenatal vitamin. Food-based just means that the nutrients are derived from whole foods, and they're typically better absorbed by the body. And definitely talk to your healthcare provider before starting any supplements just to make sure that you're okay to take them. If there's any specific ones that you want to talk to your doctor about, that would be recommended. All right, So if you do have any questions, feel free to type them in the chat box right now. If there are any questions that are more specific to your diet or for your pregnancy, or if you're wondering about something specific, feel free to email me at jessica@pdxpn.com, or you can call the number listed there. I'm also offering throughout the month of June and July, I have been doing and will continue to offer throughout July, free consults, free 30-minute consults for any nutritional concerns regarding prenatal nutrition, postpartum, or lactation help. So if you're not sure, you want to send me an email and see if that's something you want to do, that would be great. I'd love to work with you to see how I can help you improve your nutrition or help get you on the right path for pregnancy. If you're interested in signing up, you can go to the website listed, www.portlandpediatricnutrition.com, and you can go to the link to get scheduled right away. I don't think there's any questions right now, and if people are watching this later on from the replay, you're welcome to email me questions then after you're able to watch it. But other than that, thank you for watching. I hope to be able to meet you. Have a good day.